Hello everyone, welcome back to the Anatomy Lab. Today we are going to be taking a look at the muscles of the head, face, and then also the anterior neck. So let's go ahead and start by taking a look at the face and just kind of get ourselves oriented to taking a look at muscles. So to get started, you can see that we have the head here, which is going to have the face muscles, and as you can see, you have a variety of different shapes of muscles as well as directions of muscle fibers, which will help with giving you facial expressions, opening your mouth, opening your eye, and moving things in very specific ways. So let's go ahead and get started by taking a look at a very simple muscle actually, which is the one right on the front of the forehead. And in fact, this is actually on top of one of your major skull bones, which is your frontal bone. So the muscle right on top of the frontal bone, this is called the frontalis. Now, whenever you look at muscles, whenever possible at least, look for the muscle fibers as well as look at its attachment points. As like consider what body parts might it move, and then also what direction does it move it. So to look at this, you can see these lines going up and down like the front of the forehead, and kind of ask yourself, which two things do you think is going to move? Is it going to be moving the top of the eye, or rather the eyebrow, or is it going to be moving the skin of the scalp? Which technically it does a little bit, but more than anything, I would definitely say that it moves the eyebrow. And furthermore, what direction does it pull it? So being that you have a muscle up here, and when this muscle shortens, what direction does it pull the eyebrow? It actually is going to help with lifting it when it pulls it up, so elevating or lifting the eyebrow or opening the eye to some extent. So just to be clear, I didn't say up and down, just up, so this will be elevating the eyebrow. Now furthermore, a couple of muscles that we can see here are circular muscles surrounding either the eye or the mouth, and luckily they share a word which means circular, which is orbicularis, which is going to be a circular muscle. And in this case, surrounding the eye, this is orbicularis oculi. Now, a circular muscle, this is still a muscle, so when it shortens, it's going to be able to, get smaller, but when you have a circle, basically the circle gets smaller. And what this will do for the eye, at least, is close the eye. So orbicularis oculi is going to close the eye by squeezing it, and that will help with, closing the eye. Now, just to be clear, though, I didn't say open, just close, because there will be other muscles that help to do that. So to look at its counterpart down in the mouth, though, this is orbicularis oris, which is going to be surrounding the lips, and when it's going to squeeze the lips, it will help with closing the mouth a little bit at least, but more than anything, it pushes the lips kind of like forward to kind of like squeeze and purse them to kind of like a kissy face. So duck face or kissy face is what you'll be doing, or pushing the lips forward or protruding the lips, basically. Now, if you look closely, there's a little bit more on the side of the head here as well. And let's go ahead and take a look at a few muscles that are actually attached to, the jaw. So if you look over here, you can see that there are a couple of muscles attached to the jaw. These muscles are actually going down to the mandible. Unfortunately, you can't see the extensions over here, but you have two muscles here. These are going to be helping to pull the jaw upwards to close the jaw or elevate the mandible, and these two muscles are going to help with doing that. So this one on the side of the head, that is going to be where you find the temporal bone, so luckily this is called temporalis. But this one has a little bit of a different name. This one is going to be very strictly between zygomatic arch and then the mandible. And this one is a very strong muscle that helps to close the jaw or elevate the mandible. This is called the masseter. Now, just to be clear, remember I said close the jaw, elevate the mandible, so there are other muscles that help to depress them. So if you look closely on the bottom side down here, there's actually a muscle that's attached to the bottom of the mandible from the inferior aspect. In this case, this actually has two bellies though. So you have one and two. So just be careful, because this one I don't need you to know, but these two are going to be like together with two bellies, but ultimately attaching to the bottom of the mandible. So when this muscle contracts, it pulls the mandible down to help with opening the jaw, or opening the mandible, or rather depressing the mandible, which lowers the jaw. Now this muscle is named the digastric, which has two bellies, either the anterior or posterior belly. Now there are a couple more muscles that we can see here as well, muscles that are helping to form like the cheeks or the floor of the mouth. So to look at the floor of the mouth first, if you look down here, this muscle, like notice the difference in muscle fibers. This one right here was the digastric, that has muscle fibers that go forward and back. But this muscle goes side to side, and this is going to be the floor of the mouth, a very flat, broad muscle. This is called the mylohyoid. So mylohyoid, we're going to come back to mylohyoid because it's actually going to be helping us to orient to some other things. But lastly, there's a couple more over here along the side of the mouth as well. And if you look closely, you have a couple of muscles. So this muscle right here along the side of the jaw, this is going to be called the risorius. This muscle over here that connects to the zygomatic bone and the lips, this is called the zygomaticus major. So these two along the side of the jaw, helping to connect to the sides of the lips, these will either help with pulling the mouth and lips upwards and out for a big smile, or to the side for a small smile, which is called the risorius. But then down here, there's a muscle that forms like the side of the cheek. This muscle is going to be called the buccinator. So buccinator is going to be deepest out of all of these three because it's the one that's like on the inside of the cheek. Now from here though, let's actually move down to the neck region, where if we look closely, we have that mylohyoid again. And in the word mylohyoid, what bone comes to mind? That's this bone right here. Like you can see this bone right here. This bone is at the top of the neck, back of the chin, and it's kind of floating because it doesn't connect to other muscles or bones, but it connects to muscles, which in this case, this is the hyoid bone. So mylohyoid is the one that's above the hyoid, but there's also a couple that will be below the hyoid. And these two superficial muscles are ones that we do want to be able to find. The medial most out of these two is going to be the sternohyoid, and then also the omohyoid, in this case superior belly, right next to it. Now lastly, while we're still on this model, I would like to show you one more muscle, which is this one that goes right along the side of the neck. This muscle goes across the neck to your sternum and clavicle, but the attachment point over here, its insertion, is actually at the mastoid process. So the mastoid process right along the back of the ear, this is called the sternocleidomastoid, which is named exactly for what it attaches to. Sternum, clavicle, and then mastoid process back here. Now, to take a look at this on the other model, let's go ahead and switch over to see what we've got on this one now. Now, you can actually see a lot of the same things, but it's a little bit different because some of them are actually also cut. So let's go ahead and see what we've got here. So to take a look at this, if you look closely, we have the bottom of the chin again. Now look at these muscles and look at their differences. The superficial one that's going straight back and forth attached to the mandible. This one is going to be the anterior belly of digastric, which also has the posterior belly, which is a little bit shown, but to be honest, very hard to see. But then also deep to the digastric, you have this other muscle right here, and that is called the mylohyoid. So once again, digastric, anterior belly, mylohyoid underneath, which is the floor of the mouth. But looking at those muscle fibers as well as their depth, you can tell a lot of differences between the two. Now, probably one of the trickier parts of this model is looking at these neck muscles. But remember, when we looked at those neck muscles, we were looking at the two superficial ones. So there's a third one that's visible here, which is actually a little bit deep, but this is not one that we need to know. These two will be the deep ones. So this is where you'll have the sternohyoid, which is medial and superficial, and then this one will be the omohyoid, superior belly, which is a little bit lateral, but also still superficial. Now, furthermore, there's one more thing that you can see regarding omohyoid, which is that it actually goes down, but then also goes outward. So it goes down and then outward, and this will be the inferior belly of omohyoid. Now, one more muscle to go at least, and you can see that you have This muscle right along the side of the neck, it's actually connected to the back of the ear. So if that sounds familiar, this is a cut version of sternocleidomastoid. Now, there's one more thing I want to add here, though. Do you see this little yellow structure? This is a nerve. And if you know what innervates the sternocleidomastoid, that's going to be accessory cranial nerve 11. So that's what we talk about when we go over innervations, like what nerve goes to it. And this is the one that's going to stimulate it to contract and rotate your head. So with that said, that should be just about it for the muscles of the head, face, and anterior neck. So with that said, let's go ahead and finish up. Thank you for listening. Good luck with your studying, and I'll see you all next time.